Welcome again to all of you who are joining us here. My name is Kumar. I'm the president and editor-in-chief of Devex, and delighted to have been asked to help facilitate this discussion today, and seeing some folks who I normally get to see in person, but happy to at least see you virtually. Nice to be with all of you. And I know people are joining us from all over the world to be part of a really critical and key topic. Actually, on Saturday, it's World NTD Day. I think I don't have to tell people who are joining this session that that's neglected tropical diseases. I think you probably all know that, but in case you don't, or it's worth just a little bit of a refresher, these are diseases that affect some billion plus people around the world, and they're called neglected because that's sort of the reality. Often these are diseases that are relatively cheap and easy to treat, and yet because they don't affect people in some of the wealthiest countries in the world, they are often overlooked. And that was the case long before COVID. And then, of course, we got hit globally by this pandemic, which has kind of changed everything. So I am really eager to hear from the experts that we have assembled today about what this has meant for the fight against neglected tropical diseases, especially as we're looking at this important moment on Saturday on World NTD Day. So I'm really eager to hear from all of you. And I'll just mention that this is a session, again, I think you all know who are here, but that's organized by Reaching the Last Mile. It's part of their Spotlight series, which is designed to get a conversation going around global health issues. And of course, Reaching the Last Mile focuses on the last mile of disease elimination. That's their key area of focus, and neglected tropical diseases are a perfect fit for the kind of work that they're doing. So pleased to be a part of this discussion with all of you. And joining us here, we have Ellen Agler, who's the CEO of the N Fund. Hey, Ellen. Liz Agbor-Tabi, who's the Vice President of Global Policy at Global Citizen. Hey, Liz. Lynn Leonard, who is the Global Program Lead for Johnson & Johnson. And we have Leah, Leah, I'm going to try to, apologies if I mess up your name, but Wohlgemuth, who is the Senior Technical Advisor at Sightsavers. And it's really nice to be with all of you. Maybe we could just begin, Ellen. I could throw it to you for a second if I could. What has the realities of COVID, the realities of this pandemic meant for organizations like yours that work on neglected tropical diseases? What has it actually done to that effort? Has it made us overlook them more? Has it generated new interest and attention in how these issues are really global, even if they don't affect your community? What has it actually meant for you, for your work, and for the broader NTD movement?
Thank you for that question, Raj. First, I just want to say I'm delighted to be here with my fellow panelists. And I was just looking through the list of attendees and lots of friends that I also usually get to see in person and miss very much. So thank you all for joining. And I just especially wanted to call out a thanks to the leadership in the United Arab Emirates, and particularly the Crown Prince's Court in Abu-Tabi. They have been incredible champions of World NTD Day. One of the pieces of news that we got just in the last couple of days was that the executive board of World Health Organization has adopted World NTD officially. So we were celebrating World NTD Day last year, but now it's kind of on the official UN docket, which just elevates anything that helps to elevate neglected tropical diseases is so important. As you said, Raj, they are neglected diseases, but really what we often say in this community is it's not, the diseases aren't neglected because there's over 1.7 billion people that are at risk and should be getting treatment for them, but it's the people that are neglected. And so I think this past year of COVID it's come in many parts. I mean, I feel like there's, in some ways we're all here in Groundhog Day, same working from home, not able to travel, but actually in the world of this, COVID impacting neglected tropical disease, it's really happened in chapters. I feel like there was a chapter last summer where it was just everything came to a screeching halt. And there was, the majority of the world on lockdown. And so vulnerable communities, there was no treatment programs happening. And that really was a directive. That was what was safe until we figured out how would it be safe to get back to community-based treatment. And I feel like a lot of effort went into and technical teams figuring out, okay, we can't stop treatment. Otherwise, these disorders are going to be surging back. You can't afford to have people suffering from elephantiasis and blindness. And so the efforts, I think that phase at the beginning, there was a lot of pivoting to see how could the NTD community be useful to COVID. I think there's a lot of,
right, to some degree.
Yes, amazingly so. I think that there's a lot of the NTD community that helped literally support COVID outreach campaigns, messaging. I think the NTD community and the community health workers, there's so much trust at such a broad level in such local communities that sharing messages about prevention and social distancing and hand washing and leveraging our partnerships and our platforms in order to share those messages really did help. And then we've been delighted to see that in the fall, there was a lot of programs that were able to get back to treatment. It just required, more intentionality, more training, more, using PPE, having not just everything done through big school platforms, but really going door to door in many cases. And now I feel like there's another phase that we're entering where there's a lot of discussions that I'm a part of lately for how does the NTD community could be useful in the rollout of COVID vaccines in different places. Not that community drug distributors will be giving the vaccines, but how do we leverage these platforms of access, of trust, of messaging, of community mobilization. It's things the NTD community has done really well at scale for so long. I mean, it's the only public health program where over 1 billion people have been treated for so many years in a row. And when you think about the scale of vaccine rollout that's needed, I think that the opportunity for the NTD sector to be really useful and collaborative in this is quite exciting. So I think that NTDs in some ways, like so much of global health, have been further neglected because of COVID. COVID is in the spotlight. I would say from a very specific level, we've had some funders who said, listen, we can't fund you this year. We're putting all of our global health resources toward COVID. I think ministries of health are feeling really stretched, but it's encouraging to see. I mean, I was just on a call this week with some senior government officials in Rwanda. They're like, NTDs is still on the map. We need to ensure that it's integrated. This shows more than ever how important community-based treatments are, and community-based treatments like NTDs are so linked with surveillance of other diseases. So I think that link with health system strengthening and just community-based care is more evident than ever to everyone in the world. And I think that NTDs, it's a message we've been drumming on for a long time that I think is getting its moment now.
Yeah, and I do want to get into the discussion, especially toward the end of it, about where this takes us, right? Like what the lessons are and where it's going to change maybe the fight against NTDs. But Leah, maybe I can go to you because you think about behavior change. You work on the integration of water, sanitation, and hygiene wash into NTD efforts. And it is interesting now that in a way that platform is maybe becoming more important than ever. When there's a global push to get vaccines in people's hands, you have to change behavior. You have to think about last mile access. So what has it meant for your work at Sightsavers?
Thanks so much. And I really like Helen's analogy of it coming in chapters, because it very much feels like this past year has been the longest year and the shortest year simultaneously, but being able to break it down into chapters helps kind of think through it. And I think at Sightsavers, focusing on behavior change and water, sanitation, and hygiene, which we refer to as WASH for NTDs, has obviously, when you hear that hand hygiene and hand washing is one of the key ways to prevent COVID-19 or one of the behaviors that's being promoted, it's really exciting, but we also have to be cautious because, as we all know, the term infodemic has been thrown around, and there's a lot of information being thrown out there. There's a lot of people being told what to do, and information is changing very quickly. So we just want to make sure that we're not overloading people with information. And I know at Sightsavers, as part of one of our large-scale NTD programs called Ascend, we were able to, along with SGI Foundation, Mott MacDonald, and Liverpool School, amongst ministries and many other partners that are too many to be named, we were able to pivot with FCBO funding and work on some COVID communication campaigns and trainings using those platforms and networks that Ellen highlighted. I mean, I think the partnerships that we have with an NTDs and the coalitions that we've built have only been strengthened, whether it's relationships with ministries, drug companies, pharmaceuticals, et cetera. And I think that was really highlighted this past year when we were asked to do this work. It wasn't, starting to call up people and have relationships are there, countries, teams are on the ground, they're in these communities where people are being affected. And that really allowed us to move quickly, which I think during this time was really important. So we were able to develop a mass communication campaign, which allowed us to support remotely. And again, being careful about how we're adding to the information that's going out there, making sure it's accurate, making sure we're dispelling any myths or rumors, and then also looking at awareness. There's There were some trainings around testing and tracing, using these community drug distributors where safe and following, of course, appropriate procedures. But I was really amazed how quickly the NTD program rallied around it. And a lot of our ministries were part of the COVID task force, and those relationships just helped us to kind of jump right into the action and I think support and make sure we were filling gaps and not adding to any confusion or adding to any influx of information. So that was really impressive to see, and it's just a true testament to the work that's been done on NTDs over the past 30 years and how far we've come, that these relationships and coalitions are there and everyone's willing to support each other and everyone came together at the drop of a hat. And it was in times when things can be a little bleak, it was really, uplifting to see this happen so quickly.
Yeah, and it shows you, I mean, the broader concept of investing in health systems, right? Having these strong platforms, that it isn't just about any one individual neglected tropical disease or any one individual new pandemic that might strike, but about reaching those patients, right? As Ellen said, the neglected patients in the world, that those organizations like yours that have access to those patients, that work with them directly, that becomes very valuable in a moment like this. And I thought maybe, Lynn, we could go to you just to think about those patients for a second, because you lead a really large drug donation program at Johnson & Johnson for soil transmitted helminths. And, I wonder, what has it been like for patients now, who are trying to get access to medicines like yours during the course of this pandemic, when there have been lockdowns and shutdowns and supply chain disruptions? What has it meant to be a patient who suffers from a neglected tropical disease during this last year?
Yeah, thanks, Ross, for the question. And most importantly, thank you for inviting me to be part of this cross-sector panel. I think it's a really important topic today. And all of us, irrespective of the lens that we're wearing, really care about the patient most. And particularly in running the STH program, it's one of the NTDs that is probably more affected by disruption in treatment. So when the MDAs were stopped and patients were unable to get treatment, we were really working with partners to say, what are new and creative ways in which we might be able to do this? As Ellen mentioned, it was an evolving process, and by the fall, some countries were able to open up. But in the interim, we were working with partners to say, what can we do to help that?
You used to distribute these through this mass drug distribution, right? You'd get everyone together and have a big campaign and give the drugs in those settings that you can't do when you have to socially distance.
Absolutely. Most of the drugs are administered through school programs. And of course, the children weren't going to school. So in particular, I have an example in Bangladesh where we work with BRAC, where they not only did door to door, but they also did communication with different households to ensure that there was continued education, reinforcing good hand washing and sanitation practices, which of course is a benefit to COVID as well. And then I think really for the patients, what we needed to do was take a step back in the process and say, making sure that there would be drug available when it was okay for these campaigns to resume. So with that, we worked with the WHO, we worked with the ministries of health, in the different countries, and really ensuring that there was continuity in supply chain. That was, I think, supply chain disruptions were the scariest for a manufacturer of medicines. Not only the supply chain to get the end product, but the supply chain that gets us all the intermediary ingredients that make up the drugs. So what we do.
Can you just put a point on that, Lynn? Why is that so scary for people who may not understand it? Why is it so scary? Why a drug maker might think of these supply chain disruptions as a fundamental thing, as opposed to, oh, it's just a brief wait, maybe we'll be delayed by a couple of weeks. Why is it a big deal?
Yeah, I think if you're not intimately familiar with the complexities of drug manufacturing, just like you're baking a cake at home, there's a lot of ingredients that go into making any medicine, and they might be coming from all parts of the world. So whether a manufacturing plant in China was being shut down that supplied an ingredient, whether we were getting something from the US or Europe, if you're unable to get those, you might not necessarily have all the key components to manufacture the drug. And at the forefront the pharmaceutical donors, we were really concerned is, will we be able to continue to manufacture and have supply ready when it is needed? When COVID broke, I don't necessarily know that any of us anticipated that a year later we would still be in this situation, right? So, you know, we immediately convened partners. We talked about, you know, what was everybody experiencing relative to supply chain challenges, and we were able to continue our manufacturing through the year. We met our donation commitment. We looked for alternative partners to even distribute the drug through, those that might have been doing community, you know, clinics or working in different settings. So although we didn't necessarily get to do everything in the normal channels, you know, we ensured that we had continued manufacturing of the drug and made sure that the drug got into countries so that when countries were able to use it, that it was available.
I just want to remind everybody who's joining us from all over that we'd love to get your questions. Go ahead and you can ask them in the chat window, and we'll kind of look through them and compile them and try to get them into this discussion as we go forward. And Liz, I'd love to turn to you now. You know, you at Global Citizen have this big global platform where you're pushing governments to live up to their commitments and to make new commitments on big global health issues. And I wonder how the pandemic mixed with the realities of NTDs and how many people they affect and how serious they are, how that has played out in the global policy arena that you lead at Global Citizen. What has it meant for pushing governments and, you know, trying to hold them to their commitments at a moment when they might say, yeah, but we've got this new thing, COVID, we've got to put our effort and our money behind it.
Thank you, Raj, and it's a pleasure to be here. So what we're fundamentally talking about today is a question of equity. It's equity, equal access to healthcare, but you know, the disparities that we've seen with NTDs historically, and also the disparities related to COVID-19 are symptomatic of the broader underlying systemic and endemic social and economic inequities that the world faces and has faced for decades. It's reflective of the systemic barriers, the biases that preclude certain communities from access to opportunity and a life lived with dignity. Now, that's nothing new, but I think what COVID has done is it has put a spotlight on the connection between these disparities that many communities have been facing and which have gone unreported and not addressed, right? And the health outcomes that these communities show. We know that factors like socioeconomic status, education, the built environment, access to water and sanitation, the social support networks, and healthcare are critical in any society. And this is something that the NTD community has been fighting for better sanitation efforts to tackle NTDs for years. And now we've seen with COVID that that continues to remain the only way that we can address this deadly pandemic. So I think, Leah, you alluded to it earlier. It's not really about preparing for a specific agent, a specific virus, but it's really about ensuring that we have the systems and the infrastructure to be able to respond and to mitigate and actually to bounce back. Regardless of whatever the world faces. So from a policy perspective, that's the approach that we're taking. We're looking at equity more broadly. We're looking at access more broadly to ensure that no one is left behind, whether that's in the immediate acute COVID response or NTDs, but that no one is left behind as we seek solutions for a healthier world.
Yeah, you know, it's amazing because we all know this intellectually, right? That the world is a totally unequal place and that health outcomes are based on so many things in our society, all these injustices that exist across societies and within them. But then something like COVID-19 hits and it's so visceral because it affects literally everyone. Everyone has some impact on their life, but not in an equal way at all, in a very unequal way, right? So you start to see how these play out in real life. And I guess the question for the neglected tropical disease community that has been pushing for so many years to say, look, these are the best buys in a way in global health. You know, we've proven technologies, proven treatments, inexpensive. We can do this, and we have models and platforms that work. I guess the big question is COVID going to change anything about that sales pitch? You know, our governments and donors going to look at this and say, you're right. You know, we now realize in a deeper way how unequal the world is, and that there's a big opportunity to address something here, or not. I kind of wonder, and this is sort of an open question to all of you as we wait for questions to come in from our fellow attendees here, whether you think there's going to be some fundamental shift in the way NTDs are seen post-COVID, whether the pitch that you make to governments and to donors, whether there will be something really big, or will we sort of, you know, COVID will be addressed. Eventually people will have vaccines, they'll be delivered to most places, and then we'll sort of go back to the same patterns that we had before. Anybody want to pick that up?
I think there's a real opportunity here in how we can shift the narrative. You know, once COVID has been eliminated, and we hope that that'll happen sometime soon, no one envisioned that a year from last February, we'd still be here working virtually with COVID at the top of our minds, right? But I think once that's been eliminated, we have an opportunity to leverage new infrastructure, new WASH infrastructure. We will have new policy instruments to combat NTDs, certainly, and also to improve overarching global health. And I think that this is a moment that we should not squander by speaking exclusively on the importance of eliminating NTDs. But I think it'll be important for us to be much more inclusive, to also think about the broader equity challenges that the world faces. Who knew that an African-American gentleman being killed in America would cause such uproar across the globe? And we saw people on the streets in America, but we also saw people on the streets in Yemen, right? Where they have equally challenging circumstances that they live with. But I think that just speaks to the awareness that the rest of the world has on the importance of ensuring equitable societies where each member of society has equal access to opportunity, and again, a right to live with dignity. So I think this is a pivotal moment for the NTD community.
Did you want to jump in on this, Ellen, before we go to some audience questions?
Sure. I think I'm really hopeful. I think it's, you know, in the worst days, you're like, oh my God, is everything going to go back to how it was? But I also think there's never been a time where more people in more sectors have been thinking about global health a lot for the past year. And I think that's going to be in people's consciousness for a very long time. I mean, I look at young people, like my daughter is 11 years old. I'm like, she's the COVID generation. She permanently, I feel like it changed because of this, and thinking about how the transmission of viruses and the transmission and how are you affected. And I think that there's been almost a framing of this idea of people. It's so clear. Everyone everywhere should have access to healthcare. But I feel like that's been framed with a humanitarian lens, like a charitable lens. And actually, it might be helpful for governments and for us advocating for policies to people to realize, well, that's from a selfish lens too, so that diseases also don't reach everywhere. And if you don't have healthcare for everyone everywhere, then you also don't have surveillance for outbreaks that are going to happen. And I always felt like the NTDs is like the other side of the coin to pandemic outbreak, because you do need such a presence in so many communities around the world in order to be treating these diseases. And those same health workers can also be doing surveillance for outbreaks. I just think that there's a whole need just to recognize just the percentage of budget in any country that should be going to health. It's horrific to see how little dollars are being spent in some countries around the world on health, and just literally thinking expand that to just, even if it's 10% of the economy? In some places that we work are, 5% of the GDP goes to health, and that's never going to provide access and equity to everyone of basic health services. So I
You're
feel
probably
like
talking more about the government budget than even GDP. I think it's
yeah,
even
right.
much
Government,
more.
excuse me, government budget. Yes, government budget, and it's the opportunity, I think, to really advocate and focus on that, and to recognize that I think even in this time of economic downturn, the health is one of the more stable sectors. So it can help, sort of with shocks in another sense. So I think there's a real opportunity. I'm with Liz. Like, if we lose this moment, if it's our loss, like it's ours to lose in terms of global health being on the agenda, neglected people, the impact that somebody getting a disease in Wuhan can have on somebody sitting in Seattle. It's never been more clear. And I feel like the opportunity to scale up health systems and really have this be a decade of not just ending NTDs, and World NTD Day is about ending NTDs, but this interlinkage with water and sanitation, with environment, with climate, it is all interconnected. And so I feel like what is happening in this time of COVID is just increased collaboration across those sectors. And that's one of the things that I'm quite excited about, is so enshrined in the new WHO roadmap, is that real need for collaboration across the sectors to reach the outcomes that we all want to see.
Also, I was just going to add one thing to that. I definitely agree with Liz and Ellen. And I think another thing that the NTDs has done really well, and because of the people that it affects, is really to try and make sure no one is left behind. And that lens of equity and inclusion before COVID hit, it's trying to make sure all of our NTD programs are more equitable and are reaching women and men equally, or in the appropriate ratio, and are reaching people with disabilities. And that's something that we see with COVID as well. Like you mentioned, Raj, everyone's been affected, but everyone's been affected differently. Telling people to socially distance when their livelihoods depend on it, it's just maybe not possible. So I think highlighting how NTDs has worked towards using an inclusion and a disability lens to really make sure that everyone is reached, and we highlight that that's something we can bring to COVID, and we can show how to make communications more inclusive. We can show, we think about these massive communications that are going out, but what about people that can't see or can't hear or are in somewhere else? And we need to make sure that as NTDs, we can be a good example that it is possible to reach all these people at scale, and that's something we shouldn't be scared of because it's different or it's hard. And I think we have the opportunity to, with global health on everyone's mind, to show how NTDs are unique and how they can be leveraged to really make that difference to everyone. So
I want to come back.
I think it's, yeah.
I want to come back to some of these themes that, toward the end of our session, to just think about where we go from here. But we did get a question, and I want to weave it into the discussion a little if I can. Maybe Lynn, you can pick it up, which is, we've been hearing a lot in global health in general that because of the slowdowns and lockdowns and people sitting at home due to the pandemic, that there may be a number of other health issues that have been going underreported. And I'm wondering how that plays out in the NTD space. Are we seeing, for example, gaps in data? Are we seeing that numbers are going down of people affected by NTDs, or that we've been unable to distribute, and maybe not in the area you're working in, but in other NTDs, been unable to distribute medicines to the level we normally do? What have been the tangible impacts on NTDs specifically during this pandemic period? Lynn, do you want to start, and anyone else who wants to jump in?
I was on a call last week with the WHO where someone was reporting that 80% of NTD healthcare workers have been diverted to work on COVID. And then we talked about, which is variable by disease, what the delays might be in reaching goals within NTDs. And I think the real concern, right, is that that if you're not getting access to care and there's not continuity of care, whether it's for diabetes or heart disease or an NTD, right, you're going to see some level of rebound or disease progression and those sorts of things. So, I mean, to me, the message is loud and clear. And what COVID has put at the forefront is really the sense of urgency, right? And we've come together collectively to work hard and work fast to do what we can to combat the epidemic, or the pandemic. But I think then how do we leverage that and hopefully within the next decade use that thrust within the NTD community, because often patients are not necessarily afflicted with just one. In many countries, they're suffering from multiple NTDs, devastating, not only physically, but economically. And so I think it's definitely far-reaching impact, well beyond that of just NTDs, but on the society health overall.
Jump in, Raj. I think it's quite, the question is really interesting in the Q&A chat about, has it affected the identification of NTD cases during this time? And there's different types of NTDs. So I feel like that first, so I'm imagining, and I don't have the data, but like things like Buruli ulcer or sleeping sickness that are emergent and need direct clinical care are not getting identified as much because of the impact on the health system and on clinics. In the case of soil transmitted helminths or trachoma, where we treat on a population level. So we may have a few years ago done mapping and decided where's the disease, where does it need treated, and then you treat the entire community that's at risk. Well, what I have seen delayed is remapping. So we actually had plans in 2020 to do additional mapping. So it's like you've treated for a number of years. The idea is you go back and you remap communities to see how has the prevalence gone down, has the incidence gone down, and actually do you need to treat as many people? So a drug donation from J&J, can actually then be more targeted, this sort of micro precision health of after a number of years, you can get down to the sub-district level of saying there's less people, and that's better allocation of resources in terms of deploying people, of deploying medicines. And I just feel like that has been delayed. So there's just a real interest in getting more and more targeted with our treatment, and some of that has certainly been delayed.
And that may be delayed for much longer. I mean, just given how the COVID-19 disease is progressing, and the realities around vaccine distribution for most of the countries that you're talking about, if they've been delayed already, the situation isn't necessarily going to have changed for the better this year.
I don't, yes, it is. We're getting mapping done this year. It's happening. But I think they're doing it in several countries right now. There's honestly, it is amazing how much is back on track. I mean, to go from 80% of NTD workers diverted to COVID to seeing the number, I mean, we were amazed that even just the programs that we supported at the end fund, tens of millions of people still got treatment, and communities are so creative and so resilient and adopting new protocols so well that actually a lot is happening. And I think that's one of the things with NTDs that always gets, I think, just missed, that there's like, it's such a good news story. Diseases are going to be eliminated. Niger is on the brink of ending river blindness, and that will be able to be celebrated this year. There's just, so I feel like I hope that we can continue as a community to amplify these good news messages, because it can feel quite doomsday of how long it's going to take to get the COVID vaccine to the countries that need it most. I mean, I saw this statistic last week that was, 40 million people in developed countries have received COVID vaccines so far, and it was like 25 in developing countries. And it's just heartbreaking. That's got to shift, and it's got to shift really soon. But in the context of some of these heartbreaking stories, I think continuing to share the NTD successes will keep people excited about this work and about global health in general.
Yeah, you're right. And hopefully a moment like this will have created that kind of innovation. It sounds like you're saying there could be new approaches, new innovation, new efficiencies in the model. Is that what you're seeing, Leah?
Yeah, absolutely. I think to that point is we have been able, with developing standard operating procedures and risk mitigation matrices and all these things, to continue working and really stay on track surprisingly well, which is, as Ellen said, something to really shout loudly, because I think at the beginning people were scared. I know with the second wave coming again, people want to be cautious, and we need to make sure that what is being decided and the activities that are continuing are doing so in a safe way. But even what's been accomplished in a short period of time, and people were ready to get back, people were ready to get involved. And Sightsavers and partners have also been really happy to see the ability to deliver treatments, and even looking at, different ways to have different face shields when you're operating on trachoma patients. And it's just, the creativity is really amazing. And I think in a way, everyone can relate that COVID's been tough, and everyone can, it's this kind of global issue. And then it brings people to, what can we do to help? And being able to help and being able to go back to their communities and serve is all people want to do. And so being able to have that opportunity with the appropriate PPE, obviously, and the appropriate measures put in place, I think people were ready to go as soon as they were safely allowed. So it's been really, really great.
So I don't know if we have the data or whether that has been interrupted by the number of community health workers, for example, that are not on the case now, that have been diverted. Do we have any sense of whether there's going to be a bigger burden of disease around NTDs? Obviously, there's many diseases that are under this umbrella, but do we have any sense or any indication from any of you of what the picture might look like going forward?
I mean, I can't speak for all NTDs, but I know that, you know, within STH, if you're not continually dosing to keep the word burden down and reduce it, that the more MDAs you miss, or the more, you know, treatments you miss, the higher the prevalence can go. So within STH, I think there was a real concern last year, this time, when we missed the first MDA, right? And then I think, to Ellen's point, it was amazing how creative people were in the back end of the year, because they knew in a lot of these countries, we don't want to miss 2 MDAs, right? Like missing 1 was bad, missing 2 is really a problem. And really now, for those who didn't get any in last year, they're really ramping up to make sure something happens in February or March of this year. So I can't speak for how it works with all diseases, but STH is definitely you know, at risk as you miss MDAs, and but I think that where appropriate, there were creative ways to reach patients to ensure that you know, there wasn't too much of a gap.
Yeah, and these issues, of course, all overlapping. You think about students, you know, who are maybe suffering from intestinal worms, and at the same time, they've had school, you know, closures. They're trying to learn from home over WhatsApp or over radio. You know, these are all overlapping burdens for the same people often.
Yeah, BRAC in Bangladesh, I know that they were very creative in that they created comic books that they distributed about deworming and about the importance of WASH. And they also created a cartoon that they were able to put on television. So there's always new and different ways to reach people with information.
We've also heard some stories about the burden going down. It's like the COVID halo effect of everybody being focused on hand washing. I mean, we've never had a global hand washing campaign that's been at such a high profile. And so more kids washing hands actually meant that the burden didn't pop back as high. So you could sort of, during that period of high hand washing, we hope it is sustained. It's going to take effort to sustain, but it actually reduced that cycle of transmission.
I think Liz wanted to jump in. Go ahead.
Yeah, I think as a result of COVID, people are thinking about health and disease more critically. You know, when COVID hit, there was this concerted effort to get information to people all over the world, right? We learned how to flatten the curve, which became part of the lexicon of your everyday person. That was a term that you would only use in the public health epi sort of space, right? But the whole world understood what flattening the curve was and the actions that they needed to take as individuals to contribute to flattening the curve. We learned how to avoid being infected by the disease. We learned about social distancing. We learned about hand hygiene. Now, imagine if there was this much awareness around NTDs, and if there was this concerted an effort around messaging and comms to educate the world on NTDs, and then using this opportunity to really strengthen the world's understanding of the intersectionality across NTDs and the social and economic dimensions of equity and justice. I think there's a real opportunity there, and I think that it's critical that we bring NTDs back onto the global health agenda, and in a bigger way, with the lessons that we've learned from tackling COVID-19.
You know, we've brought up a couple of times already, but vaccine delivery, and particularly in these last mile circumstances, is going to be challenging. We had a question come in about that. Is there any lesson from what you all do in the NTD community when it comes to delivering vaccines, many of which, I mean, at least the early ones, require significant cold chain? Do you take away any lessons from that in terms of what it's going to mean to deliver vaccine to the last mile, to these rural communities that are most affected by NTDs?
Maybe I can start with that one. I think one of the things it's important, again, was to highlight that NTDs have relationships with these communities and with the frontline health workers. And we want to make sure, there's many players in the global health field that vaccines is what they do every day, and they know how to get vaccines to people. And I think we want to identify opportunities where there's synergies with NTDs, where there are opportunities to see how we can support and fill that need. Again, I think back to highlighting that we're filling a gap and we're not duplicating efforts, because there's a lot of interest in the vaccine, and there's a lot of kind of thinking about how we can get involved. I think the ability to reach these people in these communities that some people are not thinking about. And as that only 25 people have received vaccines in developing countries, we think about it, when that number gets bigger, it's going to be people in the cities, it's going to be people in those bigger towns to start with, which is a great opportunity. But I think as NTDs, we can continue to advocate for and identify opportunities in which our networks and our relationships can support the delivery of the vaccine to the best use.
Does anyone else want to pick up on that? I mean, vaccines are going to be the first, second, and third topic of discussion in global health this year, I think. It's something, again, very visceral. We're all looking to get our own vaccines. We're all talking to friends and family about getting them. And the inequities that Liz brought up earlier are going to be so stark, because, especially in global health, where we have colleagues all over the world, and we're going to have friends and colleagues who aren't getting it maybe for a year or for 6 months or for very delayed periods, just based on where they live. So I wondered, anything else that others, maybe Lynn, want to pick up on this?
Yeah, I think that, representing a company that does have a COVID vaccine in development, and we're also part of the NTD community, vaccines typically go into resource challenge areas largely through Gavi procurement, the Global Alliance for Vaccines. And so clearly, I think anybody who's manufacturing a COVID vaccine is working very diligently with COVID, and a lot of the orders are already in, even for vaccines like ours that are not yet approved. But the advantage of NTDs, and this has been really enlightening for me, is that we go into a lot of countries where traditional pharma products don't go. And if you have that network already built, that, we definitely have learned a lot about how do you get it there and how do you get it out to the last mile. So for example, DHL, who's the distributor for a lot of the NTD donors, has something called a Humanitarian Control Tower. And it's really excellent in terms of being able to negotiate, duty importation certificates, and ensuring that we get priority. They're aware of MDA schedules and the need to get drugs there on time. So, once again, I think this is another example of, not only doing what we perhaps do for traditional vaccines, but leveraging some of the work that's been done in the NTD community for the benefit of COVID.
Yeah, I think one thing we certainly learned is the urgency around COVID has opened a lot of doors and made it possible to do things that might have taken a lot longer before, and cut through red tape. And hopefully that level of urgency stays with us against things like neglected tropical diseases, even though they may not be this once in a generation pandemic. For people who suffer from them, it is a pandemic, right? For them, or in their lives. Did anyone else want to jump in on this point before we move to another?
Ellen mentioned earlier that it's ensuring access to vaccines and to treatment. It's about ensuring our security and safety as much as it is ensuring the security and safety of communities across the world, right? So of course, there's this selfish notion that we want to protect ourselves, but we also need to protect our neighbors, and those are neighbors that are near and dear, and neighbors that are much further away. And I think that, as we face vaccine distribution challenges, we need to do so in a manner that, again, acknowledges this intersectionality of all of the myriad of issues at hand that we've been discussing. We need to do so in a way that is holistic, that's transversal, that's equitable, It needs to be an approach that is resilient, that is reflective, that is thinking about what the lessons are that we've learned as an NTD community. We need to be able to be adaptable also in course correcting and shifting our approach where necessary. And the final point I'll say is it's simply not enough for the governments of wealthy nations to only look after themselves, but they must also ensure that the health and economic security of the most vulnerable communities anywhere in the world are also being addressed in tandem with their domestic vaccine efforts. Ellen, you said it best. Who would have thought that someone with an infective disease in Wuhan would impact someone in Seattle, Washington, New York, and would put the whole world on a standstill now 12 months later. And so I think it's just fair that to say that as we think about vaccination, let's ensure that our approaches are inclusive and that we are able to reach the last mile, the most vulnerable communities anywhere in the world.
Yeah, we had an audience question come in that's kind of aligned to this about people living with disabilities as a group that may get overlooked. This person specifically asking about children who might be at home during this pandemic while other kids maybe make it to school. Is there anything in particular that any of you would want to address on that topic? Go ahead, Leah.
Maybe I can just kind of speak to some examples from the COVID work that we did this past year, and it was identifying with the countries and governments where they felt that there were gaps in communications, because in a lot of these countries, communications were already out there, and it wasn't like people hadn't heard of COVID. Of course, you hear the cases of some very remote communities where that may be the case, but it was what we really tried to do was identify where there were gaps. And one example was in Ghana, where they said that they identified that a lot of the messages were not geared towards children or towards people in the border communities. So we made sure that we developed different communication materials. So there was videos on Facebook and social media and to be shared on WhatsApp, using children as actors and actresses to share the message. Like, I know it's not fun to stay home, but we need to do it, and making sure that we're targeting that audience in particular. And I think having these conversations and identifying that where people with disabilities are at risk for being left behind is a starting point, and identifying how we can, again, use whether it be communication messages or platforms and make sure we identify that. But it was really in Ghana, I think the Ministry of Health specifically highlighted that they were excited to see something that was actually tailored towards children to understand. I know there's been a lot of interesting things, in podcasts, and I'm sure, Ellen, you have some great examples of teaching kids how to, what viral transmission is, or different ways to explain germs to kids. And I think engaging with people at different levels of understanding is really interesting. And it's maybe something that we in NTDs think about more often than not, but the fact that the global community is thinking about how do we make sure that these people are not left behind, or these messages are great, but they're missing a huge chunk of people is a step in the right direction and something we can leverage. So I don't have the complete answer, but there's been some really promising examples from some of the COVID work that we've done. And I think hopefully with the vaccine rollout as well, we can continue to think how we can utilize that.
Yeah, I think behavior change as a broad theme is something that maybe in the health sector was sometimes seen as its own silo, and now is clearly a cross-cutting issue, to everything we're doing. We learned that certainly from this pandemic. One question is,
can I just add one thing to Leah's comment? Leah, just even another example that just occurred to me is the language around hand hygiene. For most of the world, we talked about washing your hands, using soap and water, and I think it was singing happy birthday or so, and that would ensure your hands were not contaminated. Well, in many parts of the world, Ellen, you guys do so much work across Africa, rapidly urbanizing. 60 to 70% of the population in most urban areas in Africa live in informal communities, are involved in the informal economy, and do not have access to clean, potable water for drinking, let alone washing their hands, and not to mention soap to use as part of that process. And so we also saw a lot of messaging which had been tailored to address those gaps in communities across the globe. I think there are many of those sort of examples that we can glean from as we seek to sort of shift the trajectory for global health beyond COVID-19.
Yeah, so one question that's out there is whether people who have NTDs are at greater risk when it comes to the impact of COVID-19 should they get it. And that's certainly something we've all talked about for many non-communicable diseases like diabetes, heart disease. Do we have any knowledge, or is there data yet? I mean, these are, again, neglected communities, neglected patients, so I'm not sure whether there's been enough focus on it. Do we have a sense on this panel as to whether people who have a neglected tropical disease and get COVID have a worse outcome?
I'm not sure there's been research on that from a biological standpoint, but for sure, people who get COVID and live in areas that don't have access to healthcare, don't have strong infrastructure, aren't live close to a clinic, aren't able to get tested and treated, of course, it's going to be more of an impact. So I just feel like it's layered with so many different other issues. I'm not sure the specific COVID impact with like lymphatic filariasis. I mean, maybe others or some of the attendees would know that, but for sure, just access to care. And I think one of the things that I just have been thinking about a lot is concerns just here in the United States, but that is definitely spreading globally, is just around vaccine hesitancy and sort of an anti-science movement that is frightening to see how it's taken hold. I always feel like whenever I've visited really rural communities in Africa, they're just, people are so happy to be getting vaccines. They almost want any medical appointment to end in a vaccine because like that's the thing that's going to work. And I remember years ago when it was sort of the final push for vaccinating against polio in northern Nigeria. And the Minister of Health at the time said there was a lot of communities that were just not refusing the vaccine. And when he went to meet with these imams to discuss what's the hesitancy there, thinking maybe it was a religious or a cultural reason. And he told the story about the imams pulling out their iPads and getting online to anti-vax sites in the United States and saying like, well, if they don't think it's safe. So it's like, it's this thing spread. And it's like our anti-vax movement in the US is having an effect globally. And I just hate to see like people forget it was only 100 years ago in the United States that life expectancy was only 50 because we didn't have access to clean water and access to vaccines. And just the backslide of that. I really hope that all of us that work in global health and all of us work in all sectors can use this moment to not only like take our vaccines, but to be vaccine advocates and evangelists and just reminding everyone of what the science and what the opportunity is around healthy lives and livelihood, whether it's COVID or not. So it's either COVID vaccination around the world is either going to increase anti-vax sentiment, or it could be the opportunity to really help overcome that. And I think that in this case, the NTD community really has a unique role to play because of just the trust at the community level, like the relationships for decades in some places of community health workers bringing medicines that people know and are trusted. I think that is a part of our value add and our opportunity to contribute that's super important now.
And that is part of a health system. If you think of what the definition of a health system is, it's not just the brick and mortar, right? It is also the way the community interacts with that system, the level of credibility that the health system has with people, where when your doctor or community health worker suggests a medicine or suggests a vaccine, that you understand what that's based on. And you're right, this is a really big trend. Others want to jump in on this or on the issue of COVID and NTDs?
I think that raises a really important point, Ellen, about rethinking sort of the relationships and the communities that we partner with as an NTD community here. In the African-American community in the United States, it's not so long ago that there were tests that were unethical, that were done on Black and Brown people in this country. I mean, the legacy of Tuskegee and other institutions remains quite fresh in the minds of African Americans. And so the notion of vaccine hesitancy shouldn't come as a surprise to anyone, really. But we also know that in these communities, that while there may be diminishing trust in our government appointed leaders, our public officials, that people still are able to find solace and comfort and have trustful relationships with their faith leaders. Right. And so this, in my mind, creates an opportunity to engage with faith leaders. So it's not just medicine, science, and faith and the community, but this creates a moment for us to work more collaboratively to ensure that communities are getting the right information from trusted agents, and that they are able to socialize that in a way that feels comfortable. And I think that is really important, and it can't be it shouldn't be a missed opportunity in this moment.
Fully agree.
So we're getting to the end of our time here together. It's been a fascinating discussion. I just want to make sure everybody has a chance to give us their closing thoughts. You know, Saturday is World NTD Day. This is a moment in time, I'm sure a year none of us are going to forget. We're going to look back on this one. Maybe you have a thought as to what this year could mean, or what you're hopeful for, or where you want us as an NTD community to kind of go from here. Does anyone want to begin? Maybe Lynn?
Yeah, I think, Ellen, you mentioned earlier on in the discussion about, you know, the highlighting health, like public health, and the need for universal health coverage and health as a human right. And I think that that's really something coming out of the pandemic that is so important. And as we look towards this week with the official launching of the NTD strategic roadmap and celebrating NTD, World NTD Day, I really hope that it's a springboard for us to work as a collective community and really make progress against some of these inequities. And if COVID was a catalyst to bring that to light, then, you know, it's incumbent on all of us as partners in this community to say, how do we use that to really, you know, advance our efforts and really do good for the long term? Because the goals that are being put forth are quite lofty, and we can't do it alone. None of us can achieve this alone, and it highlights the need for ongoing collaboration.
Thanks, Lynn. Leah?
Yeah, I agree. I think the other thing is we've reflected even on this call on a lot of ways that NTDs can help us move forward on activities that we've done in the past year that we've really been impressed by. And I guess I would say I kind of advocate for all of us to think back on the lessons learned that we've had over these past years. So sometimes things are just moving so quickly, we don't always take the time to reflect. And we have a lot of, hopefully, time to reflect, you know, this past year and this year coming up, to really make sure that we're using what we've learned this past year, using what we've learned in NTD programs for the past 30 years and applying that as we go forward. Because I think, you know, everything that's innovative doesn't have to be new, doesn't have to be shiny. I think there's a lot of lessons learned that this past year, like I said, this past, you know, 20, 30 years on NTDs, and make sure that we as a community think how we can apply those as we go forward and then continue to improve, you know, public health as a whole.
Well, we're at time, but any final quick thoughts, Liz and Ellen, as well, as we wrap up?
I would say this moment for us has just shown a light on the notion that discrimination, marginalization, exclusion on the grounds of race, socioeconomic status, geographic location exacerbate these systemic barriers and health inequalities that the world has been facing, and that it is my hope that we will take advantage of this moment and really use this as a call to action to ensure that everyone everywhere in the world has an equal right to a healthy life. And whether that's in the face of COVID-19 or police brutality, it is important that we ensure that everyone everywhere in the world has a right to have their humanity respected and protected.
Thank you for that, Ellen.
I know we're over time, so I would just say that there are 50 amazing people that are participating in this webinar. I would encourage every single person to go to worldntdday.org and look at the options for taking actions on World NTD Day. And honestly, there was a question in the chat box about how can we influence policymakers, and it is thinking about your circle of influence and keeping NTDs on the radar. So just thank you to all of you for just being active participants in this opportunity for World NTD Day. And thank you to all the organizers for a great discussion. All my fellow panelists, this has been so fun.
It has been. And just to pick up on one point you made earlier, Ellen, we actually are close to eliminating some of these diseases in the world, right? There's only been one disease in human history that has been eliminated, smallpox, and we're close on some others. And just imagine the virtuous cycle. Once we get the first and the second and the third of these neglected tropical diseases eliminated, and the opportunity for people to see a positive future that, hey, if we do this together, if we invest in our health systems, if we don't leave anyone behind, this is what we can do as humanity. I think it's as important as, the manned mission to the moon, or these, Mars missions or whatever. This is the kind of thing that's going to inspire people.